We want to thank our dentists now. We need you to sign up and be a part of this program. Because without our dentists and our dental community, it's only a law that was signed. But once you become a part of it, you're going to change the community.
We have a lot of testimonials that these patients come from Epping, Raymond, from afar, who haven't had care in over 20 years. These patients have a great need for dental care. So it will be a huge service that dentists will be doing and their staff accepting Medicaid patients.
Basically, like there's no dental plans around, my friend. That's what the story's about. There's no Medicaid dental. Most dentists don't have the Medicare dental plan yet. Like, for example, we don't know if my dentist will cover it. Most people need this plan. People have disabilities out there. Most people need to accept this great plan that's going to be offered.
If you can provide care for even one patient, 2 patients, 3 patients, 5 patients, to provide that care for them is going to build their confidence, to make them healthier, make New Hampshire healthier.
We've tried to listen to the concerns that the dental community has had. Will people show up for appointments? What about transportation? What about accessibility in terms of time frame?
People work. People have families. People have cars that may not be able to drive from Conway down to Keene to see that right specialist. So a care coordinator, for lack of a better term, speaks their language and speaks the language of the dentists so that they can get them together and get them the care they need. The promise of having that coordination will help dental practices refer through the Medicaid system, get reimbursed on a more timely basis. Those are all critical to dealing with a new system like the Medicaid program.
There's lots of people in the state that either can't get to a dentist that will see them, can't get to a dentist that knows how to work with them and their disabilities, and then the expense is just nuts. Most people with disabilities are on disability, that's their income, and so they can't afford that, certainly. No family should have to go through that and spend so much money just to get basic dental care.
Why would we in New Hampshire want people to suffer this way when there's a good, prudent, sustainable solution? This bill will have a direct and positive impact on the lives of many, many people in New Hampshire. So that's why this bill matters.
I have not had health insurance other than just recently Medicaid for a very long time because I work part-time. I take care of my daughter, so I have not had full-time employment to be able to have regular dental insurance. I live in a small town and there's a lot of dentists, and none of them take Medicaid, not even for pediatrics. I actually drive an hour to take my children to the dentist from Wolfboro to Concord.
There's a perception that sometimes Medicaid claims processing takes longer than the commercial side, but that's why we partnered with DentaQuest, because they're expert at processing claims as quickly as Northeast Delta Dental. So I want to assure the dental community you won't experience red tape and your claims will be paid relatively quickly, no different than if it was a Delta Dental group customer.
Currently, I'm looking for a dentist because my Medicaid benefits only covers a rare few. I have a past dentist that I would like to go back to, but they don't take Medicaid. This is partially why I'm here, is because I'm looking for someone to sponsor this and to take the ball to push it forward.
Many dentists have tried to allocate a certain portion of their practice to treat patients that otherwise were not covered, and that was difficult for them.
We are also advocating at the state level, at the federal level, to increase those reimbursement rates to attract more dentists and more healthcare workers. So that's an important part of the process as well, is making sure the dentists who participate are being reimbursed properly.
With dentists who participate, they're taking the burden off of other dentists, and they're really helping our patient population, whoever they are, whatever background they come from, find the dental home that they really need.
And when somebody has a dental home, they can build those relationships, consistency in care, seeing the same hygienist, seeing the same dentist.
Can you just take 5 families? And if that's the case, we would welcome you into this network.
In joining the dental program as a dentist, you are saying that you believe in the future of our community, the healthcare of our community, and you're willing to be a part of building that future.